What are the big downsides of ACL repair? It seems like there is no downside because it's a smaller surgery with a faster recovery and the knee feels more normal. Why wouldn't everybody do it? Well, it's not all the surgeons are comfortable doing it. I was the person who kind of came up with this approach and this technique. But the one thing is, you could fail. If you repair your ACL and then you go out, you could re-injure it. Now, you could re-injure a reconstruction also. And what's the difference? Well, if you re-injure the repair and tear it again, the answer is to do the reconstruction, which is actually easier than if you re-injure a reconstruction because you've already drilled the tunnels and taken the grafts, and it's a much more complicated issue. I used to explain it to my patients. It's kind of like getting a fourth strike when you're up to bat in baseball. You stand up and the pitcher fires the first fastball and the umpire says, "Strike 0." You look back and you say, "What are you talking about?" Well, you still got 3 strikes. A one-size-fits-all approach doesn't work. We need to have a more nuanced approach. In my opinion, it should be based on tear type and tissue quality. In addition to that, we throw in age, activity level, baseline laxity of your knees, and a bunch of other variables to determine what's the best treatment for you. You have to be careful when people talk about ACL repair when you read it out there in the literature and in the lay press, because most everything that's been written about ACL repair refers to the outcomes from the old procedure, the open procedure. But really, I want to differentiate my technique and the modern day techniques from the old data when it was done open through a 10-inch incision. Not only does this repair technique work for the ACL, but it works for the PCL and the MCL and the LCL. And so I use it all over the knee for all of the ligaments. It's especially helpful when there's very severe injuries where multiple ligaments are injured. My research group and I have published on how to classify the injuries on the MRI, which ones are repairable and how oftentimes we can repair them. We've shown that the recovery from the surgery is faster, the complications are less, the knee feels more normal. Objectively, the return to sport is faster. So it looks like modern day selective arthroscopic ACL repair is here to stay, and it's most likely only going to get better. We're working on modifications for the sutures and the techniques so that there's less foreign material, and it's only going to keep getting better. I like to think that within 10 or 20 years, we're going to be doing all of the ACL treatment without a graft because we've come up with such amazing technology.